ESCRS, the conversation around lid health is changing. Demodex blepharitis isn't rare, it isn't new, but it has been overlooked until now. Tarsus is here to shine a light on the true prevalence, the real-world burden, and a deceptively simple diagnostic step that's changing practice patterns across Europe. It's time to look at your patient's lids.
I think Demodex blepharitis has been overlooked for a few reasons. First, its symptoms overlap significantly with other ocular surface diseases and lid diseases. Second, it's somewhat viewed as a hygiene issue. It has been. And that's really not the case. It really is truly a disease that impacts patients. And lastly, clinicians haven't had a great solution for this problem. And so often when you don't have a great solution, you're not looking for that problem. It's not top of mind.
Demodex blepharitis, as many other infestations, is caused because of the fact that we are living together with many small monsters. And these are the ones who used to infest very commonly the eyelids.
Demodex blepharitis is a very common eyelid disease involving little bugs affecting the lids and the glands at the level of the eyelid and inducing itching, irritation. So in a study that we conducted, roughly 54% of the patients that were examined had some sort of Demodex colonization of the eyelids. Not every single ophthalmologist really knows about that kind of disease. I made a quick poll with colleagues not really involved in dry eye, and roughly 15 to 20% of them know about the Demodex blepharitis.
So Demodex blepharitis is a very pervasive disease. It impacts patients both clinically and in their daily lives. It is something that can cause chronic inflammation on the lids and thus the ocular surface. This is something that is important for fluctuating vision, for patient symptoms such as itching and ocular irritation. And it is something that clinicians really should be paying attention to in their clinics.
Together with the symptoms of irritation, Demodex may cause fluctuating vision, which is a symptomatic problem, but also obviously is related with measurements limitations. So if you do not have a perfect ocular surface, any biometric measurement, any topographic measurement will be affected in less or more degree. They will limit our calculations, and so they will limit our end result.
When DB is misdiagnosed in battling and winning the battle on the real reason.
So Tarsus' mission here in Europe is really to raise awareness of Demodex blepharitis and the importance of screening your patients and providing doctors education and tools through the Look at the Lids campaign about how easy it is to have patients look down and check for collarettes.
Seeing the collarettes, which are the expression of the presence of the Demodex, is extremely easy. So when examining an eye at a slit lamp, the trick is just asking the patients to look down as to visualize in a better fashion the base of the eyelashes of the superior lid, and there is where the chances for finding this collarette is higher.
Diagnosis of Demodex blepharitis is relatively simple. Proper observation of the slit lamp of these collarettes should remind to all of us that is pathognomonic of this infestation, and if they improve this, and we will stop this vicious circle with both together.
Start doing on a routine basis. It's not a matter of time, because it takes really a few seconds, no more than 3 to 4 seconds. It's not a matter of being aggressive or invasive to the patients. Only when done on a routine basis, you get that mindset to continuously do it and detect the Demodex on a systematical way.
So the message is that, first of all, this is a problem. Second, we have ways, and so it's our obligation to take care of them, to improve our patients' health.
Across Europe, clinicians are seeing Demodex blepharitis for what it is, a common, often missed contributor to patient discomfort and clinical complexity. But the solution starts with a simple step. Just ask your patients to look down. At ESCRS, Tarsus invites you to join the Collarette community. Get updates, get equipped, visit lookatthelids.eu, and take a closer look.